Hello, hello. Let's see. Are we live on all the platforms this evening? Hello. I think we're on Instagram now. I believe we're everywhere. See, Grandma Mary's in here. Grandma Mary, I love you. D. Lynn, Debbie over in Australia. I hope you're doing better this week. Roel, what's going on? I hope everybody's having a wonderful Tuesday. We'll let a few more people get in tonight. I believe we have a power outage in Kingsport, so we're waiting on Doc here. But I hope everybody's having a wonderful day, and we're going to have a wonderful show tonight, answering all your questions. If you guys have, I see you, Paige. What's going on? I see you, Brandon, over in Turks. Brandon, what are you doing on Spring Bay, watching the show? Hope you guys are having a wonderful time. My brother Tom, what's going on, man? Great to see you. Diane, hello. Roel, I hope you feel better. I'm getting over a little something as well, as you guys can tell, most likely. Hope everybody's wonderful tonight. Miss Mays on Instagram, what's up? We'll let some people come through. Real quick, if you guys, obviously at the start of the show, we kind of start the same way. We put out a couple different videos on YouTube today, as well as all the audio platforms. The Common Sense MD is with a good friend of ours, Dr. Scott Fitzpatrick, talking about the world of acupuncture. If you are interested in acupuncture or want to know more, this is a great episode to watch. I love it when we have guests like Scott on. He does such a great job just talking about what acupuncture is, what it isn't. And as you guys know, we practice integrated medicine. This is kind of a part of it. It's super cool. And then you could see there, Bo McGregor, our nurse practitioner here in the North Knoxville office where I'm at tonight. And my brother, Andy, talk about quick, urgent, or emergent. Basically, the crux of this episode is when or how to know, when you need to go to the emergency room. Obviously, there's urgent care, there's quick care, lots of different places to go. When do you need to go to the ER? And I think that's a really, really important episode. Hold on one second. Excuse me. Katie, what's up? Yes, he's the absolute best. I'm glad you said that about migraines. I didn't realize that acupuncture could help with that. Thank you for putting that in there, Katie. Stan, what's up? I see people in here. Ryan, no, I'm not. Let's see. Celeste, what's going on? Michelle, hello. Krista, hello. Great to see everybody. I hope everybody's doing wonderful tonight. We also put this in the weekly newsletter. Thank you for the like there. This was a throwback episode of Dive Into Diet with nutrition coach Lucas Schmidt, talking about the modified carnivore diet. If you guys got the email today at 3, you know that this was in there. If not, you could go to the YouTube channel and find it. Talks about his experimentation with a modified carnivore diet, what his goals are for it, why he's trying to do it, what he's hoping to get out of it. Anybody who's, kind of interested in going carnivore or a modified version of it should definitely check out that episode of Dive Into Dive if you haven't. Debbie, okay, I got you. Edna, what's going on? Great to see you. Thanks for being with us tonight, as always. Let's see here real quick. I'm going to put this up for our Tri-Cities folks. Breast thermography is happening in our Johnson City office, March 27th and March 28th. That's coming up. We've been talking about this on the show last 4 to 6 weeks or so. If this is something that is interesting to you, you can scan that QR code. I'll put it up a couple times today because we are kind of getting down to the wire here, and I believe there are still spots open. March 27th, March 28th, you can scan that QR code. And if you're interested, you can also just comment here, and we'll make sure you get in, and we'll get you taken care of. All right. That is it for the little housekeeping here. I see Robin Riddle's in here. Robin, what's going on? Good evening to you. My brother Steve, good evening to you. Um, I like the question, Ryan. Thank you for that. We'll get to that in just a minute. If you guys have a question for Dr. Rogers, go ahead and put it in the comments. We're going to get to every single one tonight. Let's see here. And I think we are waiting on Doc. Is anybody experiencing the power outage in the Tri-Cities? I know Doc is, and we're trying to get him on right now. So, Dave, what's going on, brother? Great to see you. If you're new to the show, let me know. Let me know in the comments if you're new, where you're from, and for everyone in here who's regular, say hello. I love hanging out with you guys on Tuesday nights, on Tuesday evenings, answering health and wellness questions. RDBO, what's up? Instagram, I'm looking at you guys too. We're taking questions over there. If you have a question for Doc, put in the comments on Instagram. And I believe we're on LinkedIn as well, Facebook, and we are live everywhere, I believe. Okay, cool. All right, we're gonna kind of hold our horses here and wait for Doc. I'm looking for Sandy. What's going on? I'm looking for Sandy. There we go. Thank you, Sandy. It's great to see you. Anybody new? Any new faces in the crowd tonight? And then we'll get to the questions here shortly. If you have a question, go ahead and put it in to make sure we get to it. I think I missed one on Instagram last week, and for the life of me, I cannot remember what it was. Sunday 78, what's up over there on Instagram? Thank you for hanging out with us this evening. We're getting a few people in here. Well, Ryan, welcome to the show, man. Thank you for being here, man. Let us know if you're new in the comments. We answer health and wellness questions during this hour every single Tuesday. And, if you're on YouTube, you can see we put out videos every single Tuesday as well. Jenny, what's up with an IE? I love it. That is a great question. Actually, I'm going to talk. If Robin's still listening, I want to ask Robin a question. We got a comment around the castor oil today, and around belly buttons and health. Is that a thing, Robin? If you're with us, Lisa, thank you for being here. Where are you from? Thank you for hanging out with us over there on Facebook. We're cool. Thank you, Robin. It was around castor oil, and apparently you can put it in your belly button, and that helps with gut health or something. I'd never heard of it, but I saw a couple comments today around it. Ivy, JC, and Ivy, what's going on? Thank you so much. Happy Tuesday to you, as always. I see you, Dave. Thank you for that. If anybody's new, let me know. I'd love to say hello. Thank you, Robin. Okay. So people put the castor oil directly in their belly button to help digestion. So is there like a link between belly buttons and digestion or health in some way? Okay. So it keeps bowel movements regular. That's super interesting. I saw that comment today. I don't know if anybody in here saw the post that Robin did on castor oil. It was specifically around helping with gut health, thyroid, and I believe one of her favorite uses is liver detox. Carter, happy Tuesday to you. Thank you for being in here as always. Happy Tuesday. John R., what's up? Thank you for being here. So good to see you. That's so interesting. Okay, so it's just an easy kind of way for the castor oil pipe. Super easy. Look at that. I you know what? I think Doc is in the building. We got power back up and running in the Tri-Cities. Thank you guys for hanging out with me the first part of the show. We're going to get to all your questions tonight. If you have a question for Dr. Rogers, go ahead and put in the comments. Is Doc ready to roll? We think? What's up, man?
Hey, Ben. We had a little power outage here at the house.
It was a planned power outage. Are we all good to go?
Yeah, we're back on. So.
We're back on. Look at us. And hey, I like your shirt.
Oh yeah, we got the same shirt. Wasn't even planned.
How was your Tuesday, man?
Had a great Tuesday. Wonderful. Got my Brookhaven Farm stuff in the freezer.
There we go.
Delivered today, my fresh eggs and all the meats and poultry and raw milk yogurt. That's really good.
There we go. Huge shout out to Brookhaven Farms. We love those guys. They are absolutely amazing. If you've been to Brookhaven Farms, let us know in the comments. They do such a great job. It's such a need. Thank you, D. Lynn. Thank you. That's cool. The castor oil episode with Robin really did well, and Robin told me it's kind of a hot topic in functional medicine right now. So thank you, D. Lynn, for putting that in there.
Isn't it amazing how some of the old stuff, they're finding out it really works well, when even better than some of the prescription medications. Stuff we used back in the 50s, worked just as well for different things.
What did you say? There was something, maybe it was on the last show. You said something about baking soda too. I think you mentioned it with Bill, baking soda for cramping. Was it because
a lot of athletes are doing baking soda before competition, endurance athletes.
Yeah.
It's kind of
it's almost like a performance enhancer.
It is. It's legal. I mean, all your top endurance Olympic athletes are doing it. They're setting new records because of it. And I gave it to Bill, my brother, so before he ran the Chicago Marathon. But yeah, it kind of, lactic acid is kind of a limiting factor with endurance. And this neutralizes lactic acid pretty quickly, so you have more endurance. So it's pretty cool. Read about it.
That is super cool. I'm gonna put this up from Barbara, because one, I think Katie and Carter are both in here. Did we have we put a link for the one that Doc?
I'll get you one. I'll get you a link before that it's over. I want you to look at the red light that I've been using.
And we're gonna do a video here shortly around red lights as well. Robin's already got one up on Explain This. You can check that out on the YouTube channel. Doc's going to do one here shortly. Huge believers in red light. All right, Doc, you ready for the show?
Yeah.
All right, let's rock and roll. Guys, we just got one question that came in throughout the week. Thank you in advance for the question. If you have a question live for Doc, go ahead and put it in the comments. We're going to get to every single one tonight. We're going to go till 8 and answer all your health and wellness questions. All right, this came in through email. I would like to try a 72-hour water fast. Any instructions on how to do it? Should I take vitamins, perfect aminos, and creatine as usual during the fast? So 72 hours. That's not an intermittent fasting. That's not 24. What's your thoughts on a 72?
Yeah, I tried to do a 72. Didn't quite make it to 72 for some reason, but it was fine. But there are some precautions to do when you do that. Number one, make sure you hydrate with electrolytes. The main thing I think is electrolytes. And no, I would not take vitamins. Perfect aminos would be fine. And creatine, no, I would not do creatine during it. But I would stay hydrated. If you're on prescription medications for diabetes or hypertension or any of that, you need to really look at that with somebody that knows what they're doing to adjust that, because you probably have to cut the dose down. Most likely you're not a diabetic or on those medications, but you have to be careful with it if you are. But I would use an electrolyte formulation, like LMNT. I would certainly do perfect aminos. And you might even want to monitor your blood sugar. It'd be fun to, while you did that, to put a Stelo on, which you can now get at our office. They're inexpensive, and it would monitor your blood sugars while you're doing it. The other thing you could do is get a ketone meter and see how deep into ketosis that you get. I think with fast, you have to really hang in there because you're going to go through some different feelings, sometimes emotional feelings, sometimes a lot of fatigue, um, sometimes irritability a little bit. Certainly the medications need to be looked at. Um, and when you come out of that fast, you need to do it slowly.
Mm.
Like you come out of it, you don't need to start eating everything. You need to use broth first, I would say, and maybe something like the yogurt, really really mild stuff to kind of get you back into because your stomach's not adjusted yet. Sometimes your microbiome shifts a little bit. It's not going to be a total wipe out of your microbiome, but it's be interesting. Good luck with it. Monitor everything. Monitor your blood pressure, your blood sugars if you can, especially if you have a tendency to become hypoglycemic. Get some good electrolyte formulas. Take your perfect aminos during the fast. But the vitamins and all, creatine, I wouldn't, because I like you to take that with food. Because a lot of better with fat absorption. But that's going to be interesting to do. Let us know how you do. You should do
So
fine. Your brain will probably clear. You probably start thinking really clearly when you get into that ketosis.
now I heard you say fine to continue with perfect aminos.
Yeah.
Okay.
Yeah. Just don't take the vitamin.
No vitamins.
You don't need the creatine either.
Maybe
Always.
cut back on some of your medications. Obviously talk to your provider, but consider looking at your medications as well.
Yeah.
Interesting. Is 72 hours considered long? It feels long to me.
It is long. It's a good fast. Yeah.
That's a heck of a fast. Well, keep us posted on how you're doing. Thank you so much for this question. And I'm sure people in the comments either have done one or are interested in doing a longer fast. Let us know if you guys have more questions around that. Okay, that does it for the questions that came in throughout the week. We're going to go to the live portion of the show for the next 40 minutes or so. Let's start here with let's see where we are at. Let's go to Ryan on YouTube. Ryan is asking, can you explain how Accutane affects the liver? What's your thoughts on this, Don?
Yeah, it can be toxic to your liver. I'm pretty sure it goes through that P450 enzyme system. Don't quote me on that. I'd have to look that up. But Accutane's can be a pretty toxic medication. It works real effectively. It dries you out like a chip. You have to stay hydrated with it. But it certainly is metabolized through your liver, and it can be a pretty toxic thing for your liver. So that's why they require frequent blood testing to check liver function test out. Have to watch your kidneys too, be real hydrated. It definitely works, but you need somebody that follows this very closely. It's probably not going to affect your bilirubin as much as your other liver function test, but that certainly would be one that they will check on. But it's a very potent medication that's detoxed through the liver, and it's high duty. And if those liver enzymes start to creep up, you got to stop it.
Ryan, thank you so much for that question. I hope that helps a little bit. Let's get to Jenny on Facebook. Jenny's saying, what is the most effective way to get the best benefit from broccoli sprouts? I'm assuming broccoli sprouts would be like the what would you call it?
Flower of
the flower
yeah,
part.
the best way to get the best benefits to eat them.
Yeah.
But you got to be careful if you have Hashimoto's or a thyroid problem. Sometimes broccoli or any of the cruciferous vegetables can go against you. So you have to watch out for oxalates too if your kidney stones. But otherwise, they're very healthy. I prefer cooking them, to be honest with you. I think you get, some foods are better raw, but I think on your gut, cooking them releases some of the good stuff in them. And although that's, you have people that say you should eat it raw. I don't think so. I like to steam them and eat them. I think they're you get more absorption that way. But it's a great question.
Yeah, thank you,
Wonderful.
Jenny, for that. Any broccoli lovers in the comments, let us know how you're taking advantage of those nutrients. Let's get to Dave here. Thank you, Dave, for being here as always. Any suggestions on treating dyskidrotic eczema? What causes that? And Dave, I apologize if I botched that.
You butchered that one. Dyshydrotic.
Dyshydrotic.
Yeah, what causes it? It's really drying. A lot of it's dyshydrotic. But eczema and psoriasis and atopic dermatitis are all kind of a spectrum of an autoimmune illness that it's almost like saying you're allergic to your own sweat. I've had some atopic dermatitis, and I've also had the next step, which is eczema. Fortunately, I haven't had psoriasis, which is the worst form of it, where you get plaques. But sometimes causes can be anywhere from, if it's real mild, just dehydration on the skin. But usually there's a trigger to it, an environmental exposure. But some people get it, some people don't. So you have to kind of figure out if certain foods will flare it, which it can. Certain supplements could also flare it, like niacin, vitamin B3 I've certainly seen that flare it. So you always look at the gut first, make sure you're taking, good probiotics and all, and prebiotics. And a lot of times it's a sign that you're not playing enough guitar, and you're itching. You're not focused on the guitar, Dave. I know Dave's a great guitar player, but treating dyshydrotic eczema, number one, straighten your gut out. You can certainly, if it gets bad, sometimes you have to use topical steroids, but you don't want to use those for prolonged periods of time, especially on the face, because it's too thin. And never use anything on the face stronger than 1% hydrocortisone, which you can get as Cordate over the counter. But there's a lot more heavy hitters out there. But a lot of times you can really adjust your diet, and eating a really clean diet can a lot of times clear up eczema. Andy's had
that's who I was thinking about.
He's had a terrible time with eczema. And if it gets severe, there's also biologics, but those are the heavy hitters that you probably don't want to get into unless you have really severe form of eczema or psoriasis. But keep your skin moisturized. Look for food flares, something that might, even stress can cause it.
Yeah. Is this something like, I know Andy's talked a lot about Cellcore and doing a cleanse. Would that help eczema at all, or?
Yeah, he did a 4-month cleanse, and it can sometimes work. Sometimes using ivermectin, I've seen that help as well. Sometimes low-dose naltrexone I'll put people on. That really helps it, which helps all autoimmune diseases. But if you can find the cause of it and something that triggers you, then you'd want to get off that.
Dave, thank you so much, brother, for the question. I hope that helps a little bit. Let's get to, let's see where we're at. Thank you guys for the comments around castor oil. Let's see where my questions are. If I'm missing one, let's get to D-Lynn here. I've taken lansoprazole, omeprazole, and Nexium for years. If I go half a day without one, heartburn is terrible and acid reflux at night. What can I do to get off of these? And I apologize if I mispronounced any of those, D-Lynn.
No, you did good on that.
All right.
Of course, those are PPIs, proton pump inhibitors. Mm-hmm. They basically work, but they take all the acid out of your stomach. So theoretically, you don't want to stay on them for more than 2 weeks. Some people have to. I've had patients that just could not get off of them. One thing I would do is get a scope, an endoscopy, and make sure you don't have something else going on in your esophagus, like eosinophilic esophagitis or Barrett's esophagus, because if you have those, you might be on them regardless. A lot of times too, it's a matter of getting the right probiotic mixture. You definitely need to be on a probiotic, but a lot of people, I wean people off these very slowly, and what I usually do is put them on like a Pepcid Complete, for the day between. Take one Nexium, the next day take a Pepcid Complete, then Pepcid or Prilosec. Try to just slowly taper off, like and maybe every third day, see if you can take a Pepcid Complete or two. Then every fourth day, and most people I've been able to get off of it within a month and have been on it for years. But if it doesn't turn around, you may have to get a scope to kind of look and see what's going on. I know some people were inappropriately put on that for too long a period and just never got off of it. You get kind of tolerant to it. You're used to not having any acid in your stomach, and really you need acid in your stomach to digest your food. And some foods can trigger it. You may have a hiatal hernia. You really want to get the root cause of the problem. Usually worse at night, so you elevate the head of your bed. Stay away from citrusy foods, greasy foods, coffee, tea, any kind of soda. Spicy foods sometimes do it. Sometimes I'll give people betaine, which is hydrochloric acid, to see if they really, before you start using these kind of medicines, to see if they really have too much acid or maybe not enough. A lot of these people don't have enough acid in their stomach.
Yeah.
It's probably as common as having too much. So betaine is a good way to figure that out. But I would say taper slowly, look at your diet really closely, balance your gut, and go slowly.
D-Lynn, thank you so much for that question. I hope that helps a little bit. But go back over to Facebook for Max here. Do you guys have B12 shots or liquid or similar or something similar to absorb very easily after the small intestine resection surgery? You mentioned that last week, I believe, Max. The dietitian asked me to keep my B12 monitored because the spot they removed is the place B12 was getting absorbed, and now it is gone. Also, immunotherapy shots to boost my immune system. What's your thoughts on this for Max, Doc?
Yeah, there's a thing called intrinsic factor in your stomach that's responsible for absorption of B12. And so certainly you can get shots or you can use a sublingual. I think Life Extension makes a sublingual. Make sure you're getting methyl B12, methylcobalamin.
Yeah.
And make sure you replace your other B vitamins as well, because if you just focus on one, you miss out on the others. You need to replace them all. But some people have to get a shot. Again, I prefer the methylated form. That's what we have in the office. Because you may have, there's a very likely chance you have a methylation defect, like most people do. But shots are very effective. Immunotherapy shots to boost, I don't know, like immunoglobulins. I don't know if you need to go to that extreme. You can certainly have your immunoglobulins tested, the blood test in the office. We've got an immune formula that we use that I think that's natural, that I would take before I would get immunoglobulins. Unless you have something else major going on with you, I don't think you need immune globulin shots. But again, I don't know your history as well as your doctor does. And if there's ever any question about that, ask him to run the test.
The immunoglobulin test?
Yeah.
Max, I hope that helps. And we do have the B12 shots in the office, the methyl B12 that Doc is talking about. Let's get to Debbie real quick. Debbie is in Australia Wednesday morning. Are there benefits of fasting for a type 1 diabetic?
That's a toughie. That's really hard.
Mm-hmm.
Unfortunately, it's just so hard to do it as a type 1. I don't really recommend it. Next time Andy gets on here, he'd be a great person to ask that, being a type 1. But it's just, you're going to have some wacky blood sugars. You're still going to need your insulin, and you're really going to probably have problems with it. So, sometimes even intermittent fasting's, hard for type 1s. And certainly, we talked about to the patient about, doing a 72-hour fast. That's tough.
Mm.
I love fasting because it simulates autophagy, that clearing of senescent cells. Diabetics, they're a little tougher with that. It's hard. It's hard for diabetics to do a prolonged fast, to be honest with you. One good thing about being a type 1 diabetic, years ago, gosh, type 1 diabetics died early, but now they live as long or longer than the average person because they're so well controlled. So I would just focus on getting great control of your type 1. A lot of times it's kind of off label, but we do it. And most endocrinologists are now doing it, is using GLP-1s and the GIPs in addition to their insulin. Enables you to cut back on your insulin and maybe overcome some of that insulin resistance that you develop even as type 1 later in life. Kelly does great with it.
Yeah. Debbie, I hope that helps. That is a, it's a common question I've heard people ask Andy, especially even around intermittent fasting, not a prolonged fast, but even intermittent fasting. I've heard Andy say that can be, very difficult for someone with type 1 diabetes. Thank you, Debbie, for that question. Let's see. I like this from Teresa in regards to the fasting. After a fast, I go with eggs and broth and then move forward with my carnivore way of eating. I love that transition back into eating after a fast. Teresa, thank you for putting that in the comments.
Yeah, great comment. Wonderful.
I want to get to Jerry here. Then I'll make sure I'll get to Ryan as well. How can you naturally treat a keloid from a single mastectomy?
Keloid is a scar, just a hypertrophic scar. Some people are keloid formers, some people aren't. There's some creams you can use that are compounded. They call them keloid creams. And gosh, they have some kind of enzyme with them I can't think of. Another thing I like to use a lot of is serrapeptase, which you can get at a natural food store. It's a great supplement. We did a lot of long COVID. A lot of, use serrapeptase on the spike protein detox protocol. So I would definitely try some serrapeptase, and they call it scar cream. And they use some kind of enzyme, I can't think of the name of it, to try to dissolve the keloids. The other thing I like, speaking of red lights, I like red light therapy for that. I hope to get to show you these new red lights that I just got that are amazing. Maybe I'll show them before the evening's over if I can get Jenny to bring them down. I've got a mask. I've got a thing for my back, and I'll try to.
I'm interested in the mat, show what the mat does.
Show those off a little bit.
Yeah.
But yeah, I'm a huge fan of red light. And I really like to use methylene blue before I do my red light therapy. I think it makes it more effective.
Makes which one more effective, the methylene blue or the red light?
It makes the red light therapy more effective.
Jerry, thank you so much for that. I hope that helps a little bit. I want to put this up from Lisa, and then we'll get the red light stuff up. Is the red light there? Should we go ahead and do it?
Just got my red light. This is the one I like.
Lumara.
Yeah.
Lumara Viso medical grade light therapy, high powers. Anybody heard of Lumara here?
It's really good.
I've
I'm
only
telling you,
heard good things.
it's powerful. Here's the one I wrap around my back or my knee. You can lay on it. And here is the one I have, a facial mask. That's why I look so young at 70 years old, Ben.
I had a feeling you'd be putting on this mask tonight.
You did?
I had a feeling.
You did? I didn't know I was going to do it until just now. Till I was asked that question. Here's a Lumera mask.
I think you just need to do the show like that.
I'm going to wear this on Halloween too. I'm going to give out the candy. This thing is just awesome.
How long are you supposed to keep it on?
I'm going to do a podcast on this. You work your way up, and there's different strengths, but I usually go 10 minutes, 20 sometimes.
Okay. All right, we're going to keep moving here. There we go. There's the red light.
Look at this thing.
You have to do the show like this.
No, I don't think I could do the show like that.
I think your answers will be better.
Think it makes me smarter? Yeah, thanks for bringing that down.
Okay, we're going to get to Lisa's question. Lisa, hello to you. Thank you for sharing the broadcast as always. Is there a way of healing or reversing NASH stage 3? Update, just got my PICC line out today. Thank you. Thank you for the update, Lisa.
Oh, wonderful.
And you don't know how, yes, huge. We've been thinking about you, praying for you. So thank you for letting us know, Lisa. What's your thoughts on this for her in terms of healing or reversing NASH stage 3? Yeah,
non-alcoholic steatohepatitis. Some people use the GLP-1s. Certainly, natural things you can do for it are balance your gut, milk thistle. There's other medications they use for this, prescription medications, which I'm not going to get into. I'm not a hepatologist, but some people are using the GLP-1s and seeing great results from it. But everybody's a little different on this. I'm just glad you're getting better.
Yeah.
I mean, I know you keep us updated, and thank you. And I'll look at some other variables, because a lot of times it depends on what's caused it, autoimmune, that type of thing. But definitely ought to be taking milk thistle and eating a great diet. I'm not sure about using, the bile acids that I use sometimes with cancer patients, as well, because they're pretty helpful for that. But,
Lisa, thank you for sharing this, Lisa, and thank you for keeping us posted. Keep us updated with how you're doing. Huge prayers answered there. So thank you for letting us know, Lisa. Okay, let's go to Foxy Moxie. I see you. Let's get to Diane, then I'll get to Jenny and Ryan. Excuse me. Do you test for food allergies? If so, is it a blood test or what? What's your thoughts on this one?
Yes, we do. We do a couple of them. One's an ALCAT and the other one's a Dunwoody. Those are blood tests. Now remember, those are for delayed food sensitivities, which is different than a true food allergy, which needs to be done usually at an allergist office with the pricks, scratch test. I don't think those tests are that effective though for food allergies. Most of the allergists I know don't like to do food allergy testing so much. I have found that it's pretty useful to do the food sensitivity testing because it's hard otherwise to tell, because a delayed food sensitivity, which is not an IgE type reaction, usually occurs a day or two later. After you've eaten something, you had no clue why you broke out in a rash or felt brain fog or fatigue. So it's helpful for that. Certainly it helped me a lot in knowing which foods I shouldn't, be eating much of. And a lot of times I find too that once you get the gut microbiome balanced, you're not so allergic and can reintroduce some of those in, because you'll find that a lot of times the foods you're most allergic to, I'll say allergic to, are the ones you crave the most. So don't do one of
Don't
those
say
things
that.
unless you're willing to make some changes in some things you may like. But it's a good first step. And if you're having a lot of problems with multiple allergies, because some of them could be food allergies.
Which test you?
The obvious one, well, Dunwoody or Alcat, which we do in our office. Obviously, things that are immediate reaction like peanuts and some shellfish, things like that, are actually a little bit different. Those are severe, possibly anaphylactic reactions. If you have those, you need an EpiPen around, and you may need desensitization treatment for that.
Yeah, I'm seeing here from Tom. This seems what Tom is talking about with shellfish, because that's
Wow,
that can be scary.
that is interesting.
That is wild. Thank you, Tom, for putting this in there.
That's a cheap way to get an allergy test.
Jerry, thank you so much. Thank you for being with us tonight. Okay, let's keep moving here, guys. I saw so for Diane, I'm hearing Alcat and Dunwoody. Those are blood tests.
Yeah.
And the only thing I didn't quite understand is the 2 days after. So do I need to be eating the types of food I want to?
Yeah, eat your regular. Eat everything that you do like. Eat everything that you like. What
Okay.
you normally would eat. Don't cut out the foods that you think may be causing a problem, because we need to see if you're sensitive
Got
to
it.
it. Because if you've already cut them out, it's not going to show.
Got it. Well, I'll tell you one thing. If it ever showed that I shouldn't be drinking coffee, then I'm just going to choose not to do it. Let's get this up for Jenny. On the broccoli sprout, supplements such as Brock Shot, etc., or fresh is better, more beneficial. So this question is around, like, can you get your broccoli nutrient from supplements? Or do you prefer fresh?
I actually take one myself. I take a supplement called Triple Cruciferous Vegetables, and it's a pill, and it has DIM in it, diindomethyl. And the reason I take it is to block estrogen, from testosterone aromatizing into estradiol, so it blocks that down. But I would say for routine nutrition, I think the fresh is better, especially organic. When you get that kind of food, please eat organic. When you eat foods that have a very hard shell on them, you can get by with non-organic, like an avocado, maybe an apple. You peel it, but some of the other things, it's very hard to get them clean. So eat organic, and make sure they're very clean when you eat them. And that's why I like to steam them too. That's one thing I do.
Is for the supplement, would it still be considered an oxalate?
Yeah.
Okay. Jenny, thank you for that. I hope that helps a little bit. Real quick, let's get for Ryan around the Accutane. How would it affect the bile and its containings? Would Accutane affect this at all?
Yeah, it could. I mean, the bile is stored in your gallbladder, and it emulsifies fats, and it kind of gets rid of stuff that your liver processes. So that's why you need to keep an eye on those liver function tests. But like I said, I've seen it more affect the transaminases rather than the total bilirubin. But yeah, it's a very Accutane's potent. That's why they do a pregnancy test on every woman or girl that goes in there for it. There's stringent rules with it. As a primary care doctor, I can't even prescribe it. There's certain rules you have to follow and document. I always send them to dermatology.
Super interesting. Ryan, thank you so much for that question. I hope that helps. Let's get to Roel. Thank you, Roel, for being with us as always down in Texas. Doctor, I have an upper respiratory infection and was put on a Z-Pak, Alahist CF methhyperdisolone dose pack. Thanks, Roel. Can I still take my vitamins?
He knew you couldn't pronounce.
Can I still take my vitamins? I'm also on testosterone cypionate and tadalafil losartan 25.
Yeah, sure you can. You should take more vitamins if you have an upper respiratory infection. And they're hitting you with a heavy hitter, so it should knock it out. Make sure you double up on your probiotics. But certainly you should take your vitamins. You should double up on your D and C and make sure you're getting at least 50 to 100 of zinc as well. And you'll clear it real fast. So yeah, do nasal irrigations, all the other stuff that you would ordinarily do.
Roel, keep us posted.
Keep taking all your other stuff.
Keep us posted next week with how you're improving. I'm sure you're going to improve super fast, man. We'll be thinking about you. Stan has a great question. Seeing ads for detox foot washing machine, are these things a scam or do they really detox? So a foot washing detox.
That's funny because I had a patient today that swears by them today.
Really?
Yeah, I've done a couple of them. And, I suppose they work in some way. Some people really, I don't know if there's a lot of double-blind studies on it, but when you put your feet in there, I mean, the water, which look like clean feet, and the water turns brown, you're eliminating some toxins. So you could try it, and see. Like I told this lady today, I really like a Epsom salt bath as, just as well for that kind of thing. But people say they work, and I've certainly seen some evidence of it. And I don't think they're very expensive, so you can certainly try one.
That is super interesting. It's so funny. It is interesting how, like, sometimes, what you hear in office, we'll hear here on the
Sure.
the show. It seems to be multiple people thinking about this. That's why I love this show.
It may not be a game changer for you, but
yeah. Yeah, please do not hesitate to ask your question, because I know it's helping more than just one person. That's what I'm saying here, Stan. So thank you so much for putting that in there. Real quick, let's get to Jenny on the question about reflux. Read that drinking aloe vera juice is beneficial. What are your thoughts on this?
I like aloe vera. I really do. I think it's very calming. If you have severe reflux, I've seen it cause a lot of arrhythmias as well, which some people don't even realize. I had a lady a couple of days ago, or maybe it was yesterday, that had like 30,000 PVCs on a Holter monitor in one day. It's a lot of PVCs. It's almost by Gemini. When they treated the reflux, the PVCs went away. So, esophageal spasms are a real thing too.
That is interesting.
But I think about getting a quick scope at one point to see if anything else is going on down there. Yeah, I'm all for aloe vera juice. I think it helps.
Thank you, Jenny, for putting that in there. And I'm kind of sifting through lots of comments here. Thank you guys for commenting and interacting there. Let's get to Mark's question here on YouTube. If schools require vaccinations and vaccines are effective, especially the measles vaccine, which is designed to protect against all 24 known genotypes, why do outbreaks occur among the vaccinated? What's your thoughts on this? And I hope I'm reading that right, Mark, for you.
Well, certainly you can have mutations. It's really interesting. And I mean, the measles shot can also, it's a live virus. It can give you measles. What's going on right now, there's a lot of hullabaloo they're overdoing it. I think when RFK got in there, if one person gets some measles and unfortunately dies of it, he's going to get the blame. And there's always small outbreaks of measles. And the reason, in my opinion, that people that you have outbreaks is because they're vaccinating other people and it's spread by the vaccine. That's my own, that's my own thoughts on it. It's a live virus and there's shedding going on. And, so sometimes they're doing these max vaccinations and then you see more of it showing up. Measles, it's really, when you talk about measles and chickenpox, back in the days when I was growing up, of course, everybody got them. You develop the natural immunity. And the thing about developing a natural immunity to these viruses, the childhood viruses that are common, is that it also gives you a lot of protection against other things, maybe even cancer. There may be some cancer protection by acquiring natural immunity through these types of things. So these vaccinations are, there's a lot of thoughts about them, and I admit I've changed my mind a lot about vaccinations over the past, 5 years. Of course, everybody started doubting them. There's a couple of good books you should read. One is Vaxxed, Unvaxxed, and the other one is Turtles All the Way Down. If you want to read those books, and I hope to do a podcast very soon with a pediatrician who doesn't really, he's not real keen on vaccinations, so he'll see people that aren't vaccinated. It's just an unfortunate situation that is developed. There's a lot of cognitive dissonance going on with this. There's a lot of things that the pediatricians unfortunately push because a lot of their income comes from vaccinations. And if they don't vaccinate a certain amount of their patients, they don't get bonuses. They don't get reimbursed near as much. So the pediatricians have every reason in the world. Plus, they've got cognitive dissonance. They've always been taught this. That's the way they think. That's the way it is. That's what I learned it. That's the way it is. So they don't open their minds up, and I've learned in the last few years personally that I'm allowed to change my mind about things, because you know what happens when I change my mind? I learn something new.
Mhm.
And so I really don't like all these vaccinations all at once, especially. They overwhelm some kids' immune systems. And if you're going to get them, and I think it's every right not to take them. That's your right. They should not force you to get vaccinated, in my opinion. And what I've seen in some cases, and again, I'm not a total anti-vaxxer. I don't want it to come across like that, but I've seen in a lot of cases where their kids didn't have any vaccines ever, and those kids never get sick. They just don't get sick as much. If they do, they fight it off way better. Their immune systems are better. So there's a lot of controversy about that right
Yeah.
now. I think you're going to see a change in opinion on this over the next few years. It'll be slow. I mean, it took the pediatricians 25 years to realize that you should introduce peanuts early in life. When they made that arbitrary rule, don't feed any kid peanuts until age 3. That's when the incidence of anaphylaxis to peanuts skyrocketed in kids. It's because they weren't exposed to them. And now, after it took 25 years to get them to admit that they were wrong, but now they weren't. They're changing the protocol. They want kids to be exposed to peanuts earlier than 1 year. So, you learn stuff, and you know why they call measles measles? Because it's a
No.
measly virus. It's a very mild virus. It's very contagious, but most of the time you get over it quick. And plus, there's treatments for it. That kid, that unfortunate little 10-year-old girl that died of it in Texas, she wasn't given treatment for it. You got to have vitamin A. You've got to have inhaled budesonide. So it's a shame that if you read the story about what happened, it's really interesting. Because one of the integrated medical doctors went to that family. It was a family of 5. They had 5 kids, and everybody got it. So he treated the other kids with, kind of an odd protocol of budesonide and vitamin A through cod liver oil, and they did fine. And
Well,
when that little girl got into the, they didn't treat her. They didn't treat her with anything. Just supportive care. They didn't know how to treat it. I'm not blaming the hospital on that, but there are ways to treat this that we know how. Just like we treated COVID with, repurposed drugs, and it worked. Somebody tells me every day when I took ivermectin, I got better the next day from a severe case of COVID. If anybody's heard that, raise your hand. Say amen or whatever. But I'm telling you, we've been misled a lot. And again, I'm not an anti-vaxxer, and I know that vaccines for polio and some of the things, really quelled it out. But why they keep these, they're messing around with these things too much. They're keeping these things, and they're still experimenting with them. And they get out of these labs. I think it's terrible. I'm not sure if I had more kids now, how much vaccinating I would be doing. I wouldn't be doing near as much as they want to do. I sure wouldn't be giving any kid a COVID shot or a flu shot. And if I decided to get some of the others, I would sure space it out. Read those books.
Yeah.
Look at the evidence. There's the vaccine liability is just horrible.
Do you
quit preaching.
Do you think there's value in a doctor being rigid in their thoughts? Like, I do think there is, like, some benefit to, like, the rigidity, because there's a lot at stake, obviously. How do you kind of,
like protect your own ass, right? As a doctor.
Yeah.
CYA. That's what a lot of doctors are doing.
Yeah.
No, they're not open-minded. And plus, a patient is a patient. That's their right to get treatment or to not get treatment, in my opinion. These viruses are always going to be around. The bottom line is keep yourself healthy. And if there's a treatment for measles, and the very odd chance that you're going to have problems with it. I mean, even before the vaccinations, I think 300 to 500 people died of measles per year before the vaccine. And usually when somebody dies of something like a measly virus like that, and again, I don't underestimate it. It's contagious, and it can make you feel pretty bad. But usually they're immunocompromised. Same thing happened with COVID. But they call it measles because it's a measly virus. But that's not to underestimate how you can get pretty sick with these things.
Yeah.
But the fact that it's still hanging around, look at the disastrous COVID shots. I mean, those things are horrible. That's a terrible vaccination. A COVID vaccination, number one, doesn't work, doesn't prevent spread, and it's a dangerous vaccine, if you want to call it a vaccine, with a ton of side effects. And I've seen them all. I see them in the office all the time. So, I know I'm going off a little bit, but you don't ask the question.
No, I'm glad I'm glad we're having this conversation. And Mark, thank you for teeing us up there. And Mark's right. This is it. I mean, this is what we try to do here is common sense. So Doc, thank you for delivering some common sense there. I hope that connected with a few of you. Yeah, obviously it's very, it's a very controversial topic. And we certainly don't mean to divide anybody.
Just think a year ago, we couldn't even say any of this on. We'd be kicked off the internet. We were.
Yeah.
How many times? I mean, I couldn't say 3 words. I couldn't say vaccine. Even the word I couldn't say. I could not say Fauci, which we're finding out a lot more stuff about that guy. And I couldn't say ivermectin. If I just mentioned the word, we were off.
It's so interesting. I want to put this up from Jenny, and then I'm going to get to Foxy Moxie as well. because this is something I know that you're passionate about, and you've dealt with in office, detoxing
yeah.
from the
Uh-huh.
vaccine. What's your thoughts? Can we send people to a place? What's your
You don't need to
thoughts on this?
send anybody anywhere. Anybody can do it. There's a simple detox protocol for it that we have in the office. It involves uh, um, Boswellia, curcumin, sometimes serrapeptase. Um, I said Boswellia, didn't I?
Yep.
Nattokinase. We'll print the protocol out for you, but it's Dr. McCullough's protocol for detox from the COVID vaccine. The spike
And
protein, which can persist. But yeah, if I can get Katie or somebody or Carter to print that up here, we need to put it on there.
yeah,
I give it out all the time. I can't tell you how many people. As a matter of fact, I can't think of anybody that I see in my practice that's told me they were glad they took that vaccine. 99% of them said, "I wish I'd never taken that."
it's interesting. That is interesting, Jenny. Thank you for that.
Can I get some amens on that?
Can we get some?
How many people here are happy you took that vaccine? Probably people that see this show probably didn't do it. And if you take a booster now, you're an idiot, in my opinion. You're just an idiot.
Can we get some amens in the comments here? I see you, Steve. I see you, Sandy. Thank you so much. Let's get this question from Amanda. How do you get rid of chronic kidney stones?
One, get on a low oxalate diet. Once they're in there, they're hard to get rid of. You can get them lithotripsy, if they're in the right position. Some people, Katie, she wouldn't mind telling you, she's had a lot of kidney stones. There was some formula that we got her from one of the compounders at one point that I think helped her a little bit. You have to drink a lot of water. You need to stay away from certain drinks like sodas and teas and coffee. But I think the most effective way really is probably a low oxalate diet, because most of them are calcium oxalate.
And I want to say, I'm trying to remember, because we've had questions like this on the show before, Amanda. Definitely low oxalate. There's other things. Stay away from vitamin D, maybe.
Stay away from extra calcium, and don't let
Extra
your
calcium.
vitamin D levels get too high. I mean, if your vitamin D level got really high, it could precipitate a few. Yeah. So be careful with it.
Amanda, I hope that helps. I want to get to Foxy Moxie because I saw her question and missed it. I'm having hernia surgery. Should I have my GERD fixed? So it seems they have GERD, and she's going in for hernia surgery.
Are you having an inguinal hernia, umbilical hernia, or are you having a hiatal hernia? If you have a hiatal hernia, that may take care of your GERD, but I don't know if you're getting where you're getting your surgery. So that makes a difference.
Foxy, if you're with me, still let us know in the comments. I'm going to put this up from Mark for Amanda here, cork silk extract. Thank you, Mark, for that.
I have to look that up. I don't know that.
We'll look that up as well. Thank you,
He's
Mark.
got a lot of exclamation points. So man, that's something bearing belly button. No, I mean, they're not going to fix your GERD through getting an umbilical hernia fixed. Surgery for a hiatal hernia is kind of a tricky surgery. My brother used to do quite a few of them, but it's called a Nissen fundoplication. And there's no way they're going to do both those things at one time. I'd be shocked if they would do that. So probably not, but I'd really be surprised if they went in and did both those at the same time. I don't know if they've offered you that, or that'd be really unusual. But if you get a Nissen, get it done by somebody who does a lot of them, because they're tricky.
Foxy, we'll be thinking about you. Keep us posted with how that's going. I'm going to put this up from Mark. Corn silk. It's corn silk, not cork silk. So thank you, Mark, for clarifying. Real quick, because I missed this from Ryan. 260 UL alkaline phosphatase high for an 18-year-old. So I guess so is 268 UL alkaline phosphatase high for an 18-year-old?
It depends on which lab you're looking at. I like to see the normals, but here's the thing about alk phos in a young person. Your bones are growing. So that's why that alk phos is going to be elevated. It doesn't mean you have bone or liver disease. So some people look at a teenager and they'll get, oh man, they're alk phos high. They must have bone cancer or, severe liver problem. No, it's because you're growing teenager. But keep an eye on it. I mean, obviously, you asked me the question about the, Accutane. So,
yeah,
if it was normal or lower, then you have to keep an eye on it.
Ryan, thank you for the question there. I hope that helps. Real quick for Roel, excuse me, guys. I heard a podcast that mentioned a peptide that works well for kidney stones. Have you heard this, Doc? Because I want that to potentially help Amanda here. If there is one,
it's not coming to mind. I'll certainly do a little research on that, though.
We'll look into that a little more, Roel. Thank you for putting that in there. Real quick for Mark, and then we're going to call it a show. Israel uses sunflower oils as an adjuvant for vaccines.
Carrier.
America used peanut oil as a vaccine adjuvant. Israel doesn't have the same issues of peanut allergy as America has. What's your thoughts on this?
Neither does Africa. Israel, you have some smart people over there. I'm telling you, a lot of our medical advances come from Israel. They are way more developed than we are with medical research. So I like what they're doing. I know some people use sunflower oils. I'm not big on, seed oils in anything, certainly not eating seed oils, but I know a lot of times they will use sunflower oil in small amounts as an adjuvant. I'd certainly rather have that than peanut for sure. But like I say, the reason America has peanut allergies is because the pediatrician has been withholding it from kids way too long for many, many years. So they reverse that. Now they're giving them peanuts, and getting people over this. There's also some new medications that may help do that. But that's a good point, Mark.
Yeah, thank you, Mark, for that. And I want to do this because I love Sandy, and Sandy, it's just so good to see you. I hope you're doing amazing. Real quick for Sandy, is Icurin a good supplement? Have you heard of Icurin? And Sandy, I hope I'm pronouncing that.
I forget what it's used for. Yeah, I don't know why I'm blanking out on what it's used for. It's not one that I use a lot, but maybe we should. But before I answer that, I'm going to do a little more research on it, Sandy.
Sandy, we will do some research on that. Thank you for teeing us up with that. I'm going to write that down. Icurin. Guys, we're going to call it a show. If you guys want anything in particular as far as, content with the Common Sense MD, put in the comments. I have here from last week's episode, we're going to talk more about restless leg syndrome, DMSO oil, which I saw in the comments tonight, and microplastics. If there's anything that you guys want us to, from a topic standpoint, do a Common Sense MD episode on, or an Explain This episode on with Robin Riddle, let me know in the comments. We're going to go through it tonight.
Here the dogs are. Yeah, DMSO. We've got to do one on that.
We got to do one on that.
If anybody's interested in DMSO, go to the blog A Midwestern Doctor and see what he has to say about DMSO. It's probably going to be using a lot more of it for our cancer patients, but it's a very misunderstood solvent, really. But that's going to be a great topic for a good podcast.
guys, how did we do?
Well, I
We
think
got
she's
Izzy and
too
Knight
heavy.
coming. That's the sign
Well,
we're calling it a
high.
show. But let us know how we did. If we did, don't give us a 10 if you don't think we did it. If we did a 7,
Give us an 8. Give us an 8. Here's Izzy.
I want to see a 7 if we did a 7. Izzy thinks we did a 10.
Hello, Izzy. All right,
Sandy, I'm going to write that down. We're going to get to that first thing next week. We'll be back Tuesday at 7. I'll also be looking for that. If you guys have a question you want us to start off with next week, I'll be taking note of it tonight. I see. Thank you, Lato, for that comment there. I like that. Don't take more or less than 3% DMSO. And let's see here. Sandy, I got your question. That'll be first thing next week. Doc, I love you, man.
Love you, Ben. Have a good night.
Thank you for the show, man. I'll see you guys here in a bit. Guys, that was a show. We love you. We do this every single Tuesday. This is me and my dad. Tuesdays, 7 to 8, answering your health and wellness questions. Huge shout out to Brandon who watched from Turks and Caicos. I love that.
Place. That's a great place. Have fun, Brandon.
All right, we're gonna call it a show if I can find my outro. Thanks, Pop. I love you, man.
Don't go away.